Um, Please know that if you ask any questions, it will be included in the recording. At this time, it is my pleasure to introduce our presenter and strong NASW supporter, Debbie Minsky-Kelly. Debbie is a professor at the Carthage School of Social Work, where she teaches on the subjects of psych psychological trauma, human resilience, and social work practice. Debbie's 25 plus year career as a social worker includes leadership in mental health, addiction treatments across the lifespan. Most recently, as the director of the Rogers Behavioral Health, Debbie's has also worked as child welfare, domestic violence, homeless healthcare, private practice, and childhood trauma. Debbie has published research on domestic violence and ethics related to current mental health service delivery models. She was selected as the Distinguished Teacher of the Year at Carthage College in 2021. Debbie has presented at local, state, and national and international conferences and for many agencies and organizations on the subjects related to social work ethics, trauma-informed approaches to service delivery. So at this time, I would like to introduce Debbie. You may begin.
Well, thank you. Thank you, Nadir, and welcome everyone. What better way to end 2024 than with a lively discussion of social work ethics? So I'm really excited. And as I said to Nadir before all of you were in the Zoom room with us, is that my hope really is that this is an interactive presentation. I will start off with some of the ways that I teach my students about ethics, where we talk about some ethical decision-making frameworks. But then we are going to get into some different ethical dilemmas. We're going to do some practicing of how we work through ethical dilemmas. And it's just really boring if it's just me talking. And so I am definitely going to encourage when it comes to that time for people to unmute themselves and give their opinions. Most of the time, when we talk about ethical dilemmas, there's not like a right or a wrong answer. Almost every ethical dilemma in our profession is kind of a gray area. The only like really black and white questions in our field are like whether we can have a sexual relationship with our clients, which is always no. And other, forms of abuse are always not okay. But other ethical dilemmas exist really on a continuum. And so I don't want anyone to feel like they don't want to answer a question because they're afraid of being wrong, because oftentimes we could make arguments on both sides of most ethical dilemmas. So, ethics in social work practice, again, my hope is that this can be interactive and that we can sort of lean into the ambiguity, because that is a hallmark of being a great social worker, is being able to sit with the discomfort of ambiguity and to be able to talk through some of that with colleagues, which is what I hope today can be about. So, as we think about social work values, what is always important to me in starting off this conversation is that we understand that the foundation of social work ethics is our values, which are the beliefs that are important to our profession. And that leads into our ethical principles, which are sort of ideals that we strive towards, that we may or may not ever fully realize, but these are the things that are our aspirations. And then we have our ethical standards, which are required behaviors that are enforceable. And when there are violations of ethical standards, that can result in problems, complaints against a social worker's license and sanctions and things along those lines. So it's important to understand that we differentiate between ethical principles, as I mentioned before, that are more aspirational, and ethical standards, which are binding rules that govern professional practice. And these are rules that must be followed, or there can be sanctions. So the ethical principles of our profession, which I always feel a great sense of pride in being part of a profession that centers these values in our work. So service is our desire to help people in need. Social justice is that we pursue social change on behalf of vulnerable and oppressed individuals. Dignity and worth of the person means that as social workers, we treat every person with care and respect. So it doesn't matter if that person is unhoused, incarcerated, accused of a terrible crime, a child, adult, elderly, that we believe as social workers that every person, no matter their station in life, should be treated with care and respect. We believe in the importance of relationships as a primary vehicle for change and for improving people's lives. Integrity means that we strive to work in an honest, responsible, and trustworthy manner in our professional practice. And finally, competence is our commitment to constantly increasing our knowledge and skills as social workers, which is a great reason for all of you to be here today. Um, and so then the question comes of what is an ethical dilemma? I'm actually going to put an article that I base this on in a link to this article in the chat. Let me see how I could do this really quick. Oop, did I? Let me stop sharing for a moment so that I can find my chat. There we go. I guess I have to stop sharing to do that. So here's an article that is that asks the question, what is an ethical dilemma? And so we will talk about this as soon as I get my screen back up, which is going to take me a moment.
Debbie, it looks like the way you shared it, we cannot click on it.
Oh, you're kidding. Hmm. Well, maybe I can include that article for Nadir. I can try one more time, Nadir,
Okay.
and see if this works better. But there, I'm copying the link, putting it in the chat. Let's see. Oh, I see. Is this because it's in my. All right. I think it might be because it came perhaps out of my learning management system, and you guys probably can't access that. I will send you this article, Nadir, along with my slides, if that's okay.
Perfect.
It's from the new Social Worker magazine, and it's called What is an Ethical Dilemma? But I'll be sort of summarizing the most important parts for our conversation today. My apologies for, and now you can see the article because that
Yes.
is where my screen is. But here are my slides again. Okay, so according to Karen Allen, who wrote this article, there are three components to an ethical dilemma. First, there has to be a choice. And that may seem really, really obvious, but like some people might say, I have an ethical dilemma about whether or not to report a suspicion of child abuse. Well, that's really not an ethical dilemma because we don't have a choice. We are mandated reporters. If we come across a suspicion of child abuse within our professional practice, we just have to report it. Like there's not really a choice that we can make in that scenario. There must be at least two different courses of action that are possible in a situation for it to qualify as an ethical dilemma. And then the third and probably most important part of an ethical dilemma is that whichever course of action we take, at least one ethical standard will be compromised. And so we know when we're making an ethical decision that we have to sort of like weigh the two different ethical standards that are in conflict, and we try to err on the side of the least harmful way to move forward. And so we'll talk a little bit more about that. So some common ethical principles or standards that can be in conflict, like we could be conflicted over our commitment to our clients versus their confidentiality, our commitment to our employer versus informed consent. So in some like work settings, for example, where people are working with a lot of involuntary clients, informed consent can get a little gray or compromised when the power differentials within our settings are very, very high. Conflicts of interest and commitment to client can be another area where we are conflicted, where somebody needs services. This may come up a lot in rural communities where we might have some connection to this person, but they need services. And so we have to weigh whether or not that boundary issue is more or less important than that person's need for help. Integrity and confidentiality. So, in other words, how much information are we obligated to provide to somebody? As we also work to protect confidentiality. Termination of services and commitment to client can be in conflict, especially if clients don't want to end their social work client relationship, but there are other factors that are coming into play. And then commitment to client and commitment to our employer or the community, those can be in conflict when perhaps we're working with a client whose best interests might not be the same as the best interests of the community. So, another thing I did want to also put a link to the Code of Ethics. And I believe this one should work, Nadir. So hopefully I'm not like causing too many problems here. I have to stop sharing though.
No, and someone
Um,
actually was able to find the article. Fun fact.
oh, really? Did they
Yeah.
put it in?
Yeah.
Look at that. So this is like, we're social workers, right? Like we are resourceful, we get things done. Like this audience is just proving the amazingness of our colleagues. So thank you for that. All right, so back to the slides. So the main questions that kind of come up when we're faced with an ethical dilemma is that we have to figure out what to do when two ethical standards are in conflict, and we have to make a decision about how to proceed. So, what I always like to start to do with my students is rather than trying to solve ethical dilemmas right away, the first question that we should always be asking is what two ethical standards are in conflict? And so we're going to kind of start with like easier ones and maybe get to like a little bit more complicated because if you're not like really clear on which ethical standards you have to think through, it makes it a little harder to know which ones are the ones that we can sort of violate before the others. So, what if you are at the mall with a friend and a child client comes running up to you and gives you a hug? If you think about that momentary ethical conflict, what are the two ethical standards that might be in conflict in that moment? Nadir, if you can tell me what comes in on the chat, it's hard for me to see it when I'm presenting. Or if anybody wants to unmute and just take a guess.
Um, what comes with this one is when they're at the mall, when exposing information to people that don't know about this child
Yeah.
within a
So
public setting.
confidentiality is
Confidentiality.
one.
Yeah.
Confidentiality would be one. And what would the other conflict be? Because there have to be two in conflict for it to be an ethical dilemma. Two or more. So confidentiality is one.
Which is what the chat, all three people have said, or yes, three.
Yeah.
Confidentiality, privacy, and
And
confidentiality.
so what
Professional
I would
boundaries.
boundaries, okay, that could be in conflict as well. Although I would say the primary conflict between confidentiality in this situation would be commitment to client, because that client is sort of like asking for the social worker's attention and is expressing their closeness or their desire.
Self-determination.
Self-determination, sure. So, right. So that client is expressing a need, right? Like I see
Yep.
somebody that I have warm feelings towards, and I want to express that affection towards them. So it's like our commitment to that child's well-being. If we rejected them in that moment, that could be hurtful to them, correct? So, like, we have a commitment to the well-being of our clients. And so in that moment, we might be thinking to ourselves, it could be hurtful to this child for me to reject them. And then I'm also in this public situation with a friend, and I don't want to reveal how I might know this child. So we're not going to work through this ethical dilemma right now. Again, we're just identifying kind of what the ethical standards are that are in play. Okay, so good. So we
Uh,
came up with several. Go ahead.
there are just a few questions, and it kind of sounds like you may not want to touch all of them. Somebody mentioned, I saw it, something about a person who isn't able to make their own decision making. Does our commitment to the client relate to respect for the dignity and worth of the person? Would it make a difference if the child is a past client, or is this only for current clients? Because
Well, so yeah, so those are great questions. And yeah, like everything is nuanced, right? In social work. So all of those things could make a difference. We still have confidentiality obligations even for past clients, right? And so our obligation towards confidentiality doesn't go away. I mean, I think we all know that we don't necessarily initiate contact with our clients out in the community. But for anybody that has ever worked in a community and worked with kids where so like this was my life when I was in private practice in the same community where I lived and where my children went to school. So I couldn't go to a little league game or the grocery store or any place in the community without the risk of kind of running into a client. And so I was in situations like this all the time. I would always, part of my informed consent process was to always walk through these types of situations with my clients and to tell them that I would never initiate contact with them and that it was up to them if they wanted to initiate contact with me. But then there would be these awkward situations where I'm with others and somebody comes up and gives me a hug. Again, we're not going to work through these ethical dilemmas right now. We're just working on the exercise right now of identifying what are the ethical standards that are in conflict. So here's another one. A client comes to a first session intoxicated, and you are reviewing informed consent documents. You're unsure if the client understands what you reviewed during this session. So, what are the ethical standards in conflict?
Yeah, I'd say definitely informed consent.
Informed consent is one. Can anybody think of another ethical standard that's in conflict?
Integrity?
Mhm.
Integrity. Okay. So, like, can we honestly say that we have kind of dotted our I's and can we co-sign like as a witness that this person was had the capacity to sign
Mhm.
their documents? Um,
Self-determination is coming up in the chat, and competence.
Self-determination. So competence refers to the social worker's competence, not necessarily the client's competence. But I would say this is sort of like our principle of service. So, like the client coming in intoxicated shows us that they need services, right?
Hmm.
Can they fully consent to those services is sort of in question. And so, like, the conflict is like, can we deny them services because they're like sort of coming in, like exhibiting like potentially the exact problem that they're coming for help with, right? So we're really in a bind of like, I need this informed consent in order to give services, yet I can't really state whether or not the client understood what they were signing up for. So it's like, if I can't accept their informed consent, I might not be able to give them services, yet they clearly need services. So it's truly a conundrum. We're not going to solve it right now. We're just sort of thinking about what are the ethical standards and principles that are in conflict.
Debbie, I interned
Yes.
somewhere where part of my
Yes.
time was spent at an institution that was considered drug-free and alcohol-free, and they very much believed it. So that would be a conflict, right? If the client was there and they clearly
Ah,
intoxicated, it's like,
right.
because I am part of this agency, or like they're our partner
Right.
agency.
Right. Yes. So abstinence based, treatment programs will often, deny services to
Yep.
somebody who
Yep.
comes in intoxicated, right? And I mean, I was a director of a mental health and substance abuse treatment facility, and we, kind of dealt with this all the time. And, my stance often was if our clients could maintain sobriety on their own, they wouldn't need us. So we're sort of like preventing them from receiving the services that they need by having some of these rules that like absolute sobriety is the only thing that we will accept. Like they need our help, right? And so it really does sort of become an ethical dilemma, right? Okay. A client discusses feeling suicidal and has a plan to overdose. The social worker recommends hospitalization, but the client refuses this recommendation. The client continues to express significant safety concerns and will not agree to any safety plan the social worker suggests. So, again, we're not solving this right now, but what are the ethical standards that are in conflict?
Self-determination and commitment to the client.
Client. Yes, yes. So the client's well-being is at great risk
Hmm.
in this situation and their self-determination. So we cannot both protect the client's safety and uphold their self-determination at the same time
Right.
because of this dilemma, right? Excellent.
Yep. There's duty to report just as further examples, and safety to
Yes, yes.
individual.
We will work through each one of these.
Yeah.
I'm not just
Okay.
going to leave you all hanging.
Okay.
I
All right.
promise. I promise. We will work through all of these.
Okay.
But I just feel that sometimes we jump into trying to solve an ethical dilemma before we even identify what standards are in conflict. And so I feel like oftentimes as social workers, we have to slow down a little bit and say, what are the standards that are in conflict? So an activity that I do with my students to say, hang on, what are the ethical standards that are in conflict? We have to know our code of ethics and be able to identify these standards as kind of like that's what I feel is kind of step one in the process. Okay. A social worker starts working with a new client. They've been working together for about 6 weeks. At this point in their work, the client explains a situation in which it becomes clear they have used the social worker's husband's company to have some work done. It doesn't appear the client is aware that they are using a company associated with the social worker's family, but the social worker is now aware of it. So, what ethical standards are in conflict here?
Conflict of interest.
Hmm.
Conflicts of interest is one, yes.
There's competence that came up as another option. Dual
Okay.
relationship is another.
Yeah, yeah. So dual relationships and conflicts of interest are sort of the same.
Same.
So here's what I'll say is that it's in my opinion there's kind of a termination of services question here because had the social worker known going in, they might not have taken this client. And so the question is because the social worker indirectly might be financially benefiting from this client utilizing their partner's company, does the social worker have to terminate services? But at the same time, we can't abandon our clients. The client and the social worker were not aware when the relationship started that this was happening. So this is actually a real situation from my practice.
Mm.
Um, where my husband had an unusual small business where he supplied some food items and things to different like sporting events and things like that. And it came out over time that my client was like the manager at like one of these venues, like snack shops. So she was like purchasing and she was it came up some item that she purchased and I was like, oh shoot, that's my husband. And like it was right in our area. So I knew that it was his company. Obviously couldn't tell my husband. So there was confidentiality.
Mm.
Um, and I had been working with this client. And so I had to maintain a commitment to them, and yet there was a conflict of interest
Mhm.
because I was indirectly financially benefiting from this client utilizing my husband's company. So there were a lot of different ethical standards that were at play in this situation. So, again, we're not going to solve it right now. We're just sort of identifying the standards. Did anything else come up in the chat about this, Nadir?
Um, just reiterating the conflict of interest and commitment to client. And then it does
Correct.
sound like some folks have some suggestions on how to solve it, so I'm purposely not reading those.
Yeah, we're gonna get there. I promise you, we're gonna get there. I just, again, I'm trying to like build this muscle of like, we have to know what the ethical standards are before we solve things, right? Okay. A social worker does community organizing work with a grassroots organization. The social worker discovers that an active volunteer has stolen money from the group
Mm.
and privately asks the individual to step down from their role. This volunteer tells other members of the group that the social worker kicked me out. Other group members question the social worker's reason for this decision. So, what ethical standards are in conflict?
Okay, so commitment to client is coming up.
Mm-hmm. So the organization is the client, right? We're committed to protecting that organization. Absolutely.
But then the confidentiality and
Confidentiality, correct. Yes. So I'm sorry, the community is the client.
client.
Um, and the confidentiality of this sort of internal situation. Any others?
Could,
Um,
could competence be something?
I would say more integrity, right?
which
So
did
like
come
we're
up,
up
which did come up.
integrity and competence. Yeah. So like we have to like uphold truthfulness and, the just put the overall well-being of this community at the top of, and so we have all of these competing responsibilities, right? So yeah, so again, another really nuanced and complicated situation.
Debbie, I
Okay.
want to say
Yes.
potential interruption of services coming up, and then
Mm.
termination of service, or yeah, that termination of services.
Ah, right, because the volunteer, that might be like a very meaningful activity for them. And so like what responsibility do we have to people who are volunteering their time even when they have like a lapse that might be harming, and could we lose other volunteers if we don't kind of explain more what has happened, although there's like so many minefields in this situation. Okay, so again, when we come across these types of situations, we have to go through a process. We have to find some sort of ethical decision-making process. So I'm going to go over some different models, and these different models have strengths and weaknesses, but it's good for us to understand different models for ethical decision making as we work through situations like this. So I'm going to go through 7 different models: deontology, utilitarianism, intuitionism, Hippocratic oath, beneficence and non-malfeasance, proportionate reasoning, and using an ethical principle screen. Just so you know, I am going to provide all of these slides to Nadir, so you don't have to like furiously be taking notes on every single thing. You will get all the slides. Okay, so deontology makes ethical decisions based on fulfilling our duties or obligations. It's kind of the golden rule of treating others how you want to be treated. It treats decisions as inherently right or wrong. So there's a lot of clarity when it comes to deontology, very rules-based, like the Ten Commandments would be an example of
Mm.
deontological decision making. But the weaknesses are that the complexity of problems that we face in social work often don't lend themselves very well to black and white rules. The contrasting model to deontology is utilitarianism, which judges ethical behavior by outcomes or consequences of our actions. And so it looks to creating the greatest good for the greatest number of people. So utilizing a utilitarian approach can lead to a lot of social benefits. So like vaccination programs are considered utilitarian, even though some people might have a small reaction or have a bit of a negativity to the vaccination. The overall global benefits of vaccinations are seen as outweighing the small discomforts that people have to go through to participate in vaccination programs. Now, the weaknesses are that individual consequences are seen as less important than the overall impact on a larger group, and that sometimes knowing an individual's outcome will be very hard to predict with utilizing that form of ethical decision making. So deontology and utilitarianism are sort of opposite ends of a spectrum that would look at many situations very differently. So, in a situation where a driver sees a child on a bike that is about to run into their car, and in order to avoid the child on the bike, they would actually have to run the stop sign. So, accelerate through the stop sign in order to save the bike rider. So, from a deontological perspective, you never break a rule. So, you have to stop for the stop sign, regardless of the consequences. Whereas under utilitarianism, you would obviously run the stop sign to save the child. And so, again, it's just some of the contrasts between a deontological and utilitarian approach to ethical decision making. Utilitarian decision making asks a lot more questions, looks a lot more at gray areas. So, what are the circumstances? Like, if somebody were to steal a loaf of bread, under a deontological ethical decision-making model, this would always be seen as wrong, no matter the circumstances, whereas the utilitarian would ask a lot of questions. What are the circumstances? Is the family hungry? Is the bread going to a good enough use to justify the stealing? And what is the greater good? Okay, another ethical decision-making model that probably doesn't get as much attention as it should, but that we all probably use many times as social workers on a day-to-day basis is intuitionism. And so this is just kind of our gut feeling of like what feels right in this moment. And so this is easy and quick, and small ethical questions that come up every day are likely solved by intuitionism. The weaknesses are that if we're not really careful and being intentional and taking more time to think through decisions, we may run into problems. So I had a situation many, many years ago. I was actually a student intern at the time within a school setting, and a child in the school, they had a fire. And a teacher came to the school social worker's office and said, we really want to do a donation drive. This family has lost everything. And the social worker's gut reaction was, that sounds like a great idea. How can I help? And so they organized this entire thing and came to find out later that the family was offended by this decision. They weren't consulted initially. And so this is something with using intuitionism. Sometimes we're not always thinking of all of the steps that we need to go through in an ethical decision-making process. But again, it's something that we probably all utilize very often. The Hippocratic Oath comes up often in healthcare settings where the first responsibility is to do no harm. So the highest value under this ethical principle is to avoid harming those that we serve, and always asking the question of whether our actions could potentially cause harm to our clients either now or in the future. Similar to the Hippocratic Oath is this idea of beneficence and non-malfeasance. And so beneficence is that obligation to do good, that all of our actions are aimed at helping people to improve their lives. And non-malfeasance is again that obligation to avoid harming others. And so I kind of look at beneficence and non-malfeasance as like the floor and the ceiling between which our work should always operate. So we should never dip below avoiding harm, but we should always be striving towards that beneficence that we want to do something to benefit those that we serve. Proportionate reasoning. Some people call this the gold standard of ethical decision making. So, this is a framework where there is tension between our obligations of causing no harm and doing good. And so, we're weighing the harm versus benefit of a given decision. And so, this is probably what we're going to focus on. Proportionate reasoning and the ethical principles screen, which I'll go over as well as we move forward with more ethical dilemmas. So the three issues or questions that we think about in proportionate reasoning is whether the value that is compromised or the ethical standard or principle that is compromised is of equal or less importance than the one that is embraced. So an example of this is like when you're treating cancer patients, we're using harmful medications to treat that cancer, but it's aimed at extending life. So we are willing to do temporary harm to people with these harmful medications for the benefit of extending their life. But we also choose the least harmful way to achieve our goal. So we would use the lowest dose of the medicine or the least toxic form of that medication or are the least restrictive way that we can find to keep a client safe. So we also want to be sure in proportionate reasoning that the highest value that we are trying to protect is not undermined in the future by our current actions. And then but we don't always know. So, like in proportionate reasoning, it says the value that we're compromising has to be of equal or less importance than the one that is embraced. And so, this is where the ethical principles screen is, which is this is sort of a hierarchy of what are our most important values, our most important ethical standards, and sort of ranking them so that we know. Which one, if we have to compromise one, which is the one that is more okay to compromise. So we'll probably come back to this slide and take a look at this as we go through those ethical dilemma situations again. I'm a kind of a visual person, and so I sort of just created this little 4-quadrant graph where we see that there's highly important values in our profession and less important values. There's really big violations and then smaller violations. And so what we should really always be thinking about is how can we, if we have to violate something, we want to violate something that is less important and violate it in the smallest ways possible. So this is what should always be our goal as we are working through ethical dilemmas. So back to being at the mall with a friend and a child client comes running up to you and gives you a hug. So I am going to go back to the ethical principles screen. And so what I see in this situation, I'll just kind of do the first one, and then I'm going to like look to the audience to sort of help us through the next ones. So I feel that the way I look at this situation through the ethical principles screen is that it could potentially harm my child client if I were to just ignore them when they come running up to me in the mall. And so number 4 on our ethical principles screen is about least harm. So I, in this situation, would reciprocate the hug. But then when it comes to privacy and confidentiality and truthfulness and full disclosure, you can see that these are lower down on our ethical principles screen. So in that public situation, I obviously would not disclose to the person that I'm with in the mall how I know that child. I would probably make some vague statement and just say, oh, I just know them from around the community or something along those lines. So I'm not violating their privacy and confidentiality. And even if just that recognition was a small violation of their privacy and confidentiality, it's still lower down in the ethical principles screen than that least harm, which was my concern that if I rejected this child's overture towards me could be potentially harmful to their sense of our relationship. And again, that truthfulness and full disclosure is also further down on the ethical principles screen. So does anybody have any questions about how I worked through that? Nadir, was there anything in the chat about that?
No, there's just folks putting in their emails.
Oh,
The
great. Perfect. Perfect. I
um,
see the chat is very active,
yes,
so,
there
but
was
I'm
a
not seeing the
question
question.
though
Oh, oh, go
earlier.
ahead.
Um,
Okay.
I could also see deontology at risk for assessing morality to decisions based on personal values.
Right. Yes. So absolutely. And so, there may be social workers out there who have strongly held religious beliefs and things along those lines. When we are working in our professional capacity, we are obligated to uphold our social work values. And so that's obviously a challenging situation when we may be placed in a situation where our personal values are in conflict with social work values, right? And so that's another complexity to dealing with ethical questions. But that's a really, really good point. That deontology is often based on religious principles, not necessarily social work principles. Excellent. All right. Was there anything else there, Nadir?
Nope, just more more emails.
Okay, excellent. I'm so glad that people are building community. That's absolutely what this is about as well. So that's great.
Yes, I shouldn't. Sorry,
Okay.
yeah,
Well, I mean, this is part of, what's one of our core social work
that's
values? The
true.
importance of relationships, right?
That's
And
true.
so, like, relationships among social workers are a really important way that we network and maintain our health and well-being as a profession. And so I'm all for it.
Yep.
Okay.
I wanted to add for those who are sharing their emails, my thought, because I think let's help you connect, is I can include that in the email that I send out to folks. But if you, for whatever reason, would prefer I don't do that, you can go ahead and message me or email me. So there.
All right. Excellent. All right, so back to our client coming to a first session intoxicated, and you are reviewing informed consent documents. You are unsure if the client understands what you review during this session. So we can look back on our ethical principles screen and think about where the different areas of potential ethical violations would come up in this situation. I wonder if anybody would be willing to unmute and try to walk through how they would handle that situation of that intoxicated client. All right, hearing nobody,
Um,
I am happy. Oh, do you
um,
have somebody? Oh, yes,
okay,
go ahead.
so
Yes,
I'm gonna try. Don't judge me.
go for it. Yes.
So with the intoxicated client, I think I will ask him would he like to reschedule until
Hmm.
he sober up.
Mm-hmm.
That's the first thing that comes to mind. And if
Okay.
he says no, I think I would say the scaling 1 through 10, how comprehensive are you? Would continue
Mm-hmm.
this session. But my first thing is to just to reschedule.
To reschedule. Okay, so
Uh,
Hmm.
that's interesting. Go ahead.
I was just going to say someone else mentioned rescheduling as well.
Okay, that could be an option.
Or I can continue the session, but however, move on to as far as what made you become, what triggered you to overdrink and some, because obviously
Mm,
he still wanted to come to the session even though he
hmm.
was intoxicated. So I
Right.
would probably go on, what address the need as is, Like what
Yep.
made
Yeah. Yeah.
you, what triggered you to drink that
Yeah,
night?
yeah.
What, so I'll ask them questions and stuff like that.
So,
And
so in a sense, yeah, so that's really, really excellent and interesting because in a sense, you are still assessing. You're moving forward with that question. You are moving forward with the assessment process with this individual, in spite of the fact that we're not 100% sure that they understood what they were signing up for. And so first of all, look at the very top of our screen, that protection of life. So we want to know how that client got to us, right? Did they drive? Because one thing
Hmm.
we want to be
Hmm.
really sure about is that we're not allowing them to go back out onto the streets in a vehicle intoxicated. So that is definitely something that we have to address as how are we going to make sure that they can get back to their home or wherever they came from safely. So that's definitely one thing. The other thing that I see on this ethical principle screen that jumps out at me is that exactly what our caller just said of beginning the process of some steps towards the assessment
Hmm.
is kind of a least harm. Like I don't see where the harm is in asking some of those questions and continuing to try to engage this individual in their treatment. Because you see way down at the bottom is that truthfulness and full disclosure. And so that's really, in my mind, what informed consent is being sure that our clients have full knowledge and understanding of the consequences of staying or agreeing to the treatment that they're signing up for. And so reducing harm, improving quality of life, we believe that this individual seeking treatment is important. And so certainly in my mind, we can take some steps of engaging them with that treatment. And then the next time they come in, hopefully we continue to review the informed consent in subsequent times when we see this individual, hopefully not intoxicated in subsequent sessions where we can reinforce and be sure that, and we're documenting as well, that we once again reviewed the informed consent to ensure that the client understood, maybe ask them to repeat it back to us. And there's other ways of determining their understanding of that informed consent. Does that all kind of make sense to people?
Yeah. So there are some things in the chat. Just
Yes.
and um, talking about rescheduling the appointment, I would reschedule and make sure the client is safe if the person is driving to the session. Um,
Hmm.
I would say to him that I appreciate you coming to see me, but I sense you've been drinking. Do you think we need to reschedule when you haven't been drinking? Um,
Mm.
I kind of like that one because I know there's a,
Yeah.
I like that one because it kind of helps you, it shows that you're observing things, but you're empowering the
Yes.
client to make decisions.
Yes.
Um,
Absolutely. Absolutely.
and then
Yes.
this other one is I would let the client know that them coming intoxicated to their appointment is of concern to me, and I let them know I care about them and their
Hmm.
health. After I showed support, I would assess the reason and see if there's anything I can do to help. Um, and then there's this question, and I think this is for you. What if they signed and then you start seeing signs of drinking? Does that cancel consent?
So
So,
yeah, so I think I would do a really good job of documenting. And so I would say that the client signed the consents and subsequently there was this concern of their potential intoxication and whether they fully understood the informed consent and that at for sure at their next session, we will have to review that informed consent process again. So we want to continuously check in with that individual as they continue their work with us to be sure that they understood what they were signing. But again, the intoxication is like a flashing red light of the level of need. right, of this individual. So like, so again, like I certainly understand the instinct of like telling somebody to go home, yet at the same time, we want to provide service. Like that is one of the things we strive for. That's that beneficence. We want to do things to help people. I totally get the argument that they may not absorb very much while they are intoxicated. And so you also I would also want to be thinking about what is the likelihood of them coming back if we completely close a door and say, I will not see you right now. But so I like the exploration of like what led you to drink, before coming to this session, et cetera, and really working to establish that trusting relationship so that the work can continue when they are in a better state of mind.
And then somebody says, I would be wary of becoming a barrier to them receiving treatment if they got turned away while intoxicated.
Hmm.
Um, so that's what they're saying.
Go ahead.
I kind of, I don't know, I'm struggling because I'm thinking about the agency that I did some of my work with when I was
Yeah.
interning and
Yeah.
how it's like I don't want to turn them away, but in some ways that couldn't be the space. It would almost be like, go meet
Sure.
me at this other office that I will be at in a couple hours. It's like this weird.
Well, but you make a really good point because sometimes our social work values conflict with our agency's values. So that's another potential conflict. And so we have to understand our agency's policies, and we may be obligated to uphold those, even though they may not as cleanly um, align with how our social work values and ethics are prioritized, right? I saw somebody had their hand up, Nadir.
I did too. Do you want to go ahead and
No, you already went over it. You said it as that was I was about to say too. It all depends on the agency policy. So that's what you
Correct.
said. But I will
Correct.
continue
Yes.
to see them if the agency policy said that he can still come while he's intoxicated. Because I want to look at the fact that he made it to the appointment
right.
even though he was
Right.
because I
Right.
bet he
Yeah.
could have just said that something in his mind said, well, let me make it to the appointment.
Right. Right. Right.
Um,
Yes.
and Megan, I just want to say this was a past agency because you're saying it, Nadir, it seems like you're struggling with the commitment to your organization/employer. With that particular agency, I had a few struggles. Um,
Yeah. Yeah, absolutely. Absolutely.
and then there's back to the comments. I'm also thinking of individuals who may be functional alcoholics, substance users, um, who may who may never come in fully sober.
Correct. Great point. Great point. And again, so, I mean, there are these like sort of two different schools of thought in the addictions world. There's kind of like the abstinence-based folks and the harm reduction folks who are more into like maybe, reducing the amounts that people are using and, reducing harmfulness and things like that. And so, oftentimes these conflicts can come up between these two schools of thought in the addictions world where if and so again if we're basically saying that the rules of our addiction program is that you can only come in completely substance free. I mean, if our people could maintain that lifestyle, they wouldn't need our services. So it's kind of we're put in my mind like those oftentimes those philosophies are really like putting people into an impossible situation because the help that they need is just not within their reach because they're addicts, right?
Right.
So anyway, so that's a
Doesn't
difference. Go ahead.
Yeah. Doesn't part of the standard of assessing somebody's consent is kind of like once you've gotten to know them which is hard the first time, but as a client
Sure.
and knowing their barrier, right? So, yes, I had folks who came in, some who had been clearly drinking or using other substances, but their barrier of understanding, it was like, well, I know you have a sense enough to make a decision.
Sure. So
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 that,
just because somebody's
right,
intoxicated does not mean that they can't consent,
right.
right? So like we might want to assess that. Repeat back to me your understanding of what you are
Hmm.
consenting to.
Hmm.
What are my limits of confidentiality? Da 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 da, right? What are the risks and benefits of you signing on to this program? So there are ways that we can, so that's like a way of sort of minimizing your uh, the way that you're violating an ethical standard. So yes, we can so yes, they may not have full capacity for making like the best decisions right now, but we also assess that and we assess that they were reasonably able
Yep.
to repeat back do you know what I mean? And so like we sort of violated it less fully by taking those
Yep.
steps,
Yep.
right? Yeah, okay.
There's also in the chat back to the example of the agency that may not
Mm-hmm.
be on board. Folks mentioning referrals and how referrals are very helpful and also part of the ethical
Yes,
standards. And that is what I
for
often
sure.
would do, by the way, is make a
For
referral.
sure, for sure. Yeah. So, okay. So we're taking a lot of time, which is awesome
Sorry.
because I really love all the conversation, but I have some really fun ones at the end,
Okay.
that we haven't even touched on yet. So let maybe, because some of these are maybe, I mean, not that this one is like run of the mill, but like we're all sort of trained on dealing with suicidal people. And so it's a pretty easy one because protection of life is way at the top, right? So
Hmm.
we can obviously undermine autonomy and freedom. We can undermine privacy and confidentiality if it is to save somebody's life. So there are those duties. We know that we can break some of these lower level ethical standards when it's a life or death
Yep. Yep.
situation. So that one's pretty clear. The community organizing work, again, I would say that we we're committed to the least harm to the community and asking this individual to leave the organization was our effort in my mind to minimize the harm to the community that we're serving. And that truthfulness and full disclosure and privacy and confidentiality, while we are going to uphold the privacy and confidentiality because that's higher than so we don't really owe truthfulness and full disclosure to the others doing this community organizing work. But it's still a very challenging situation, right? Because um, it can impact the perception of our peers about our integrity, right? When there's a narrative that's being put forward that we did something that was unfair. And so sometimes in a situation like that, I might say to my colleagues in that community organizing work, there are just certain things that you're going to have to trust my judgment on, and I can't really share the details. And hopefully, you've established that reputation where people will accept that sort of an explanation from you. But it's difficult. Okay, so a lot of ambiguity,
Hmm.
often not a clear right or wrong way to handle these situations, but that we should be able to recognize what the steps were that we went through in our ethical decision making. And oftentimes it's important to document that this is the decision I made. These are the steps that I took in coming to that decision. Because if things go bad, down the line, having that documentation will be very, very important. And so we
Debbie,
talked, yes,
I think
yes,
something we didn't talk about that I know I do all the time is the consulting, right? Whether it's a peer, your
yes,
supervisor.
absolutely. Yes. Thank you, Nadir. That is huge in social work, and that should also go into your documentation. So we don't have to make ethical decisions on our own, right? So I mean, many of you may call Mark at NASW if you're members and talk to him about ethical decisions. And guess what? Mark sometimes calls me. I'm
Uh,
part of like
Debbie,
I
just
am one of yeah.
these are folks from across
Well,
the country. So Mark is the
oh,
executive
right.
director
Oh,
for
I'm sorry.
NASW
I'm
Wisconsin.
sorry. Yes. You may call your local chapter. That's right. I totally forgot. Sorry, Nadir. You're like the voice in my head, and you're forever associated with Wisconsin's NASW. So Mark Herstead is our NASW director, and if you are an NASW member, oftentimes you are allowed to consult with your ch local chapter for on ethical dilemmas. And even our director, Mark, he will sometimes call me when he is stumped by an ethical dilemma of one of our members. So consultation is huge. Even those of us with decades of experience in the field, I still go and I consult with my colleagues in higher education, or sometimes I will contact my NASW chapter when something novel comes my way. And oftentimes we're so embroiled in a situation that our objectivity is not as good. And so having that outside consultation, peer consultation, supervisor consultation, hugely important in our field. So thank you for that, Nadir. And so and again, and then those consultations can be included in your documentation, consulted with supervisor. We considered these factors. We realized that this ethical standard was more important to uphold, and we took these steps to, minimize the violations. So even in the situation of the suicidal client, well, we are violating their autonomy, right? By potentially hospitalizing them involuntarily. So, what are steps that we can take to violate their autonomy less? So, we might say, well, which hospital would you rather go to? This one or that one? Give them some autonomy in the process. How would you like to get to the hospital? If they can safely go with a family member rather than via an ambulance, we might be able to allow for that depending on the assessment of the situation. So, any ways that we can provide some level of autonomy within the process would be important. And so, again, we can have personal values conflicts with our social work values. We can have social work values conflicting with the values of our workplace, as we've been hearing about. Our values may conflict with our clients' values in different times. And so those are all things that can make this tricky. In 2018, NASW revised the Code of Ethics to address technology issues for the first time. And so there are many ethical dilemmas related to technology that can come up in social work practice. And so Nadir told me that because this is an audience largely of students, that ethical dilemmas that come up during student internships would be of primary interest. So I have a couple that were really interesting that I'd love to share with you guys. So during COVID, when we were all learning new technologies and delivering services remotely, we had some really interesting situations. So I had a student working in a child welfare supervised visitation agency. And during COVID, all of these visits were being conducted over Zoom. So this was really, really challenging. So clients and professionals were still learning how to utilize Zoom. So there was a big question of our competence, but we had no choice. We just had to switch because of the pandemic. So I had a student who was remotely supervising a visit with a child and their mother, and the child and the mother were together for the visit in the same location, and the social work student was remote. At the end of the visit, it was clear that the mother thought that she had ended the Zoom call, but the Zoom call had not ended. And so the student observed that the mother's partner was also in the room, which had not been obvious during the visit. And there was a no contact order in which that mom's partner was barred from being around the child. So the student overheard a conversation between the mother and partner without their knowledge of the student still being on the call. So let's think about what ethical standards were at play in this situation. Any ideas?
You say standards or the principles?
Well, you can pick either, and they may not even all be on this ethical principle screen. So you can identify any that you feel apply.
So I would definitely say confidentiality.
So confidentiality
There's
was an issue. Yes.
potential protection of life. That's coming in a few times. Uh,
Okay, because there must have been some sort of concern about the safety of the child around this partner.
Truthfulness and full disclosure. And then,
Truthfulness and full disclosure or informed consent, right?
right,
So like this client did not consent to the social work student still observing them after they thought the Zoom call had ended, right? So like they were not aware that this was like a risk of doing this visit over Zoom, that they
right.
would still be observed potentially after they felt the call had ended. So
There's
go ahead.
somebody is saying protection of life, autonomy and freedom, and then numbers, truthfulness and full disclosure. I keep struggling with the client is the child, right?
Mm,
Like if the client was the mother,
mm-hmm,
I wouldn't feel great,
mm-hmm,
but I would feel a little
mm-hmm.
bit more like, well, they're making their decision.
Yes. Right, right. So, and I mean, in this, it really, this situation really reminds us of the chaos that COVID brought to all of our practice, right? That we couldn't have even imagined all of the policies that we needed to have in place that we didn't have in place. But obviously, in a child welfare situation, the student had to report that this person with the no contact order was with the child because of that high priority of that protection and life, the safety and well-being of the child was paramount. But what also wound up happening, and so it was really an amazing learning experience for our students, was that our students brought this concern to their supervisor and then were able to bring it kind of up the chain within the organization where they were doing their internship so that policies could be implemented to include in the informed consent that it is possible there is a risk of doing these sessions over Zoom that things will be observed that you were not aware of or that you did not plan for or that you if you don't properly end the call the social worker can potentially see things that you would have otherwise wanted to be private and confidential, and so that is a risk that so that policy was changed in terms of how that agency conducted its informed consent procedures in the future. So sometimes working through a complicated ethical dilemma helps you to see that policies need to be updated in order to protect people, within our ethical frameworks. Does that make sense?
Mhm.
Okay, excellent. Okay, another situation. Um, a student was working in a foster care agency with a parent who had lost custody of their child. And that parent suggested a relative of theirs as a potential foster care option while the child was unable to be in the home. And the student intern noted that the foster care worker conducted a social media search of the suggested relative in an effort to determine if this was a viable option for the child. So, what are people's thoughts about this? What ethical standards or principles are at play here?
Protection of life and quality of life just came in.
Oh, interesting. Okay. Do we all know that in 2018, with the revision of the code, that there was a specific ethical standard added that we are not allowed as social workers to do social media searches of our clients without their informed consent?
Mhm. Privacy, competence are coming up.
Yes. Privacy. So that's the main concern about doing social media searches of our clients without their consent. Now, there are some exceptions, like if it's an absolute like crisis situation, there are some nuances there, but it did not really seem to our students. So our student was aware that this was not allowed for a colleague to be doing this social media search under these circumstances, and that was specified in the 2018 revision of the code, because it really didn't qualify as a crisis. There are other ways that foster care agencies should be vetting potential foster care placements, and social media is not necessarily, the approved mechanism for handling that. And now, certainly, if you get consent from somebody, like a foster care worker could say, you were suggested as a foster care placement, do you give consent for me to look at your social media? And if they say, absolutely, I will do anything that I need to do to become the foster care placement for this child, then you have that informed consent, and then that is an allowable step that can be taken. So that's the primary violation, is that's a violation of people's privacy for us to be looking at their social media. Now again, that oftentimes our clients are looking us up on social
Yeah.
media. And so that is not a river that flows in both directions, right? So our clients do not owe us any ethical treatment, but we owe them ethical treatment, right?
But
So that is definitely something that is an important thing for us to recognize in our field.
Debbie, I mean,
Yes.
I'm going to push back a little bit. Like, I think even if you have consent, you better use only in an emergency because of the power dynamic at play, right? You
Mm.
said your example, you said that they're willing to do anything. So we can't put an unnecessary barrier and a barrier that wouldn't meet our code of
Mhm.
conduct. And then someone else says violation of privacy, or you're using your bias. Um, and then that's interesting
Mhm.
because the employers will quickly check social media profiles to determine if someone's employable. Um,
Yes, but we're not in a client
right,
role with that
right,
employer,
right,
right? So
right.
yeah, so absolutely. This is what I tell my students too, is like your employers will absolutely be checking your social media. So like one of our first assignments before our students even go into their internships is to like have a third party, a friend or a family member, check their public social media, Google their names and see what comes up, because there shouldn't be surprises. Like none of us should be surprised about what people are going to find if they search our names, in social media. So it's definitely a really important exercise. And I totally appreciate what you said, Nadir, that we don't get carte blanche just because somebody says, yes, go ahead and look me up on social media. Um, we would probably have to be very specific of like, these are the platforms. We would want to really
Yeah.
know that we have permission for each specific search that we're going
Yep,
to
yep,
do.
yep.
Yep. Even like in Wisconsin, we have our court files are public records,
Mm-hmm.
and in some agencies, it's their practice to we call it CCAP here in Wisconsin, to CCAP people. But even that is has to be done with some form of informed consent in the process. Even though that's not social media, it's just doing any sort of an electronic search is really the way that it is written in the Code of Ethics. Okay, so other technology related um, ethical dilemmas. A social worker begins work with a new adolescent female client and informs the client of the agency's social media policies. This client presents as quite depressed and lonely following significant issues of cyberbullying. All of the peers in her school decided that having this girl as a friend on social media was no longer acceptable. So nearly every peer unfriended her in an effort to isolate her socially. After their first session, the social worker received a friend request from the client. She included a note expressing her loneliness and hoping the social worker would consider accepting her as a friend so she knows at least one person cares about me. Should the social worker accept or decline the friend request? What are your thoughts?
I think the social worker should explain to the client first on the reason why she cannot accept her
Hmm.
friend request. I wouldn't
Yep.
decline it just yet. I would ignore it first until I
Hmm.
explain to her the reason, because that can probably trigger her and set her off if I declined it.
Okay, so
So that's
hold
what
off
I.
on declining it. Now, the social worker had already discussed the social media policy with this client, and the client still made the request given what she had been through. And so, again, we do have these policies, and it's really interesting because somebody actually posed a question like this to me when I was doing an ethics and technology presentation. And it stumped me a little bit because the wording in the code is that social workers should avoid social media contact with clients. And so every word in the code of ethics is really, really important. They could have used a stronger word. They could have said shall. Shall is absolute, and should is like almost always, right? So the fact that they used should in the code of ethics for social workers should avoid social media contact with clients, it made me sort of wonder, um, what if declining that social media request would actually do harm to a client? And do we have to weigh a situation this extreme on in some different way? Again, I am not advocating. I mean, I'm not even on social media. So this is the way I have resolved social media is that I just don't use social media so that I don't ever have to like deal with these questions from clients or former clients. I have a long social work career and just, so many former clients that I just don't even want to deal with it. So like then I'm just never in the situation, but I'm of a different generation than many of you. So I get it that that doesn't even feel like plausible to many in the younger generations. So I don't know. What are other people's thoughts about this?
There's some chatter. Um,
Yes.
Someone again mentioning talking about it in a session, another person mentioning that this is a setup for dual relationship.
Yep.
Um, I have former clients on my Facebook page that have asked, but I haven't accepted.
Hmm.
Um, and then there's another person who said, and I think this is interesting, accept on a professional page and decline on a personal page.
So that's really interesting. And so I am seeing more of that as a solution where social workers have like a professional account and a personal account. And so that is an alternate way of handling this because the Code of Ethics does not say shall, it says should avoid these social media contacts. I think that that is potentially an emerging way to sort of navigate this question, um, where you use one of your accounts for only like highly professional types of communication and maybe marketing what you're doing and things along those lines. So
And
so that's
then
a really, really interesting
there's this
idea.
question for you. And how would you handle dual relationships in extremely rural areas with social media?
Mm,
And I would extend that to say in kind of like small communities. So one of the agencies that I partnered with was an LGBTQ resource center in Milwaukee. And while
mhm,
Milwaukee's pretty large, there's only two really
mhm.
LGBTQ resource centers. I have a feeling that they were Facebook friends with each other. Like,
Oh, right, 100%. Yeah. So it's really, really tough when you're part of a small community, whether it's a rural community or like a minoritized community where the worlds just constantly collide. And there's people that have need, right? Like let's say I'm the only trained, autism spectrum provider in a 50-mile radius, and I live in a rural town. And, my hairdresser says my kid's on the spectrum. I can't find anybody to work with them. Can you do this? So like on the one hand, we are obligated to provide service. We have a commitment to our clients. And we also have to avoid these dual relationships. And so people in these smaller communities face these dilemmas all the time. And so they really have to do really, really detailed, informed consent as to the risks and the benefits of working with people who they have other relationships with. And so people, rural providers, providers in these smaller communities, whether it's a place or as Nadir suggested, just a smaller community within a community, oftentimes they deal with the dual relationships because they understand that there's people in need and they may have a certain area of expertise where otherwise people would go without service. And service is one of our primary values as social workers.
Um, Somebody commented, I got many requests from individuals at my group homes. I just gently remind them of policies. Also, I have a having relationships outside of work could not only hurt treatment process, but could affect the quality of care. And another person, I realized I kind of skipped it earlier, mentioned that for that
Mhm.
client who Facebook friend requested in this scenario,
Mhm.
that they would decline the request and then connect the person with anti-bullying and bullying prevention resources. And
Nice.
I sort of think that like part of what you clearly have to talk about with the client is reminding them there are friends outside of social media. There's more that, as much as it doesn't
Mhm.
feel like that sometimes.
Yeah, yeah, absolutely, absolutely. Um, all right, let me see. Are we good? Can I go on to a new one? These
Um,
are always just so much fun, in my opinion.
yes,
This is like a hobby of mine, Nadir, to just like
I know.
think about ethical dilemmas all day. Okay. A social worker runs a support group for women. The group participants have become friends and arrange dinners with one another outside of their group sessions. One of the group members posted a photo of them from a restaurant on Facebook with the caption, "These are my therapy girls." One of the group participants complains at a session that she feels this was a violation of her confidentiality. Now, again, I think any of us that have run groups have always, as part of the informed consent, we say, don't take pictures of each other, don't post about this on social media. And no matter how many times we say it, these things really do happen. And so how would we handle this?
I don't want to be the person that always saying something.
That's
So let
okay.
me,
We love it.
okay. So I think for me, before the group even start, I think I will get permission if they care if they take pictures, they care if they post
Hmm.
it. So up front, I will state that in the group before it begins to avoid
Yep.
any try to issues or anything like that.
Yes. And what I have seen in my practice is that even doing that, um, people violate it. Social media is so prevalent. So one of the things that what do I want to say? How do I want to say this? So the people that write the code of ethics are much closer to my age, which is mid 50s, right? Technology immigrants, as we're sometimes called. We didn't grow up with these technologies. And many of the people who are navigating these ethical rules are of younger generations who are technology natives and where technology has just become such a part of their lives that sometimes those of us that are writing the rules and interpreting the rules are not fully understanding the lives of who these rules are impacting, right? And so what's hard is that as social workers, we have these ethical obligations and our clients don't. There's really not a lot of recourse that we have when one of our clients violates the confidentiality of another client in a group. I mean, we can kick them out of the group, right? Like that is definitely an option. And then there's ethical questions about that too, right? Like if they still need the services, is this a ethical termination of services? So it can be really, really complicated. So we are obligated to uphold the standards, but like our clients aren't necessarily. So what are there any comments in the chat, Nadir, that
Oh,
you'd like to?
there's quite the chatter. Folks, a lot of folks agreeing, saying that I would restate the policy, and
Hmm.
some making a distinction to say I'd restate it as a group and also individually. Um, and then there's others saying I would set boundaries with the group as a whole and make this clear in preventing it again in the future. Somebody mentioned this could almost be tricky because the group met outside of a group session at dinner.
Yeah, right, right. So do the rules apply outside of the therapy session, right? It's a great question, right? So yes, we've discussed these rules. Like sometimes groups take on a life of their own, and how do we feel about that, right? The importance of human relationships. We believe that there is something positive about these relationships potentially being a vehicle for change, for positive change in people's lives. So, do we want to interfere with those group members having relationships outside of the group? I mean, it brings up so many different questions. I'm aware of the time, Nadir. We have like 3 minutes left.
And I have one
Um,
question for you that someone asked earlier
yes.
that I ignored. Um,
Okay. I'm gonna stop sharing.
okay. The question was, what would you suggest if somebody has to make a decision relatively fast, if you don't have time to consult, and you've got to kind of make an ethical decision quickly?
Yeah, it's really hard, right? So, I mean, that intuitionism is something that we all use. And I think that there are situations where you can buy time, where you can say, this is a really tough situation. I am going to need to think this through. I might say I'm going to give you a preliminary opinion right now, or make a preliminary decision, and I reserve the right to sort of decide something else once I consult with my supervisor, consult with my colleagues, because we sometimes are in those situations where we don't have time to really work through an entirely thoughtful process.
Well, thank you so much. And
No, absolutely.
um, there are no CEUs for this event, although thank you all for attending. Um, so I'm going to go ahead and read my script now. Thank you all for joining us for Ethics and Boundaries. Um, as a social work student, how to handle sticky situations with Debbie Minsky-Kelly, presented as part of the NASW student series. A recording of today's workshop will be available in the new year. We hope to see you next month for using social work case vignettes to prepare for your licensing exam on Thursday, January 16th from 6 to 7:30 Eastern. This concludes today's program, and you may now disconnect.